In the landscape of empirical inquiry, the concept of research equivalence occupies a position of profound methodological importance that is often underappreciated by researchers and consumers of research alike. Equivalence, fundamentally, addresses a deceptively simple question: when can we genuinely say that two things are the same in a meaningful research context? This question permeates every level of research design and interpretation, from clinical trials evaluating generic versus brand name drugs to cross-cultural psychology comparing personality constructs across societies. Brigham and Women's Hospital and Harvard Multi-Regional Clinical Trials Center, 2022. The significance of equivalence extends beyond technical statistical considerations into the very validity of research conclusions. When researchers claim equivalence, whether between treatments, measurement instruments, or constructs across populations, they must establish this through rigorous methodological and statistical procedures rather than merely failing to detect differences. The distinction between not statistically different and statistically equivalent represents one of the most consequential yet misunderstood principles in research methodology. Ponce-Renova, 2022. This essay examines the multifaceted concept of research equivalence, exploring its statistical foundations, its application across research contexts, and the methodological frameworks for establishing it with confidence. The statistical foundations of equivalence testing. Equivalence versus difference testing. Traditional null hypothesis significance testing (NHST) is fundamentally designed to detect differences. Researchers typically formulate a null hypothesis that there is no difference between groups and then seek evidence to reject this hypothesis in favor of an alternative hypothesis that there is a difference. The critical error that pervades much research literature is the logical fallacy of concluding equivalence from a non-significant result. Ponce-Renova, 2022. As Altman and Bland famously articulated, absence of evidence is not evidence of absence. Cited in A Proposal for Interpreting and Reporting Negative Studies, 2025. A failure to find a statistically significant difference does not mean the treatments or measures are equivalent. Rather, it may simply indicate insufficient statistical power, excessive variability, or inadequate sample size. Equivalence testing requires a fundamentally different statistical framework. Rather than testing for the presence of a difference, equivalence testing seeks to demonstrate that the difference between treatments or measures falls within a predetermined range considered practically insignificant. Ponce-Renova, 2022. This range is defined by equivalence bounds, lower and upper limits within which the true difference must fall to establish equivalence. Welleck defines equivalence as equality except for practically irrelevant deviations. Cited in Ponce-Renova, 2022. The determination of these bounds is not a statistical decision but a substantive one, typically made by experts in the field based on clinical or practical significance rather than purely statistical considerations. Brigham and Women's Hospital and Harvard Multi-Regional Clinical Trials Center, 2022. Implementing equivalence testing. The practical implementation of equivalence testing involves several key steps that distinguish it from traditional difference testing. Researchers must first specify the equivalence bounds, sometimes called the smallest effect size of interest (SSOI), based on substantive knowledge of what constitutes a meaningful difference in their field. Ponce-Renova, 2022. Subsequently, they must calculate a confidence interval for the difference between the measures being compared. If this confidence interval falls entirely within the pre-specified equivalence bounds, then equivalence can be claimed at the chosen confidence level. Brigham and Women's Hospital and Harvard Multi-Regional Clinical Trials Center, 2022. This approach offers several advantages. It provides a direct test of the equivalence hypothesis, produces a p-value specifically for equivalence, and makes explicit the criteria by which equivalence is judged. Equivalence testing has been extensively used in pharmacology to demonstrate that generic drugs produce equivalent effects to brand name formulations, and increasingly in educational research to compare different pedagogical approaches. Ponce-Renova, 2022. When replication studies fail to find differences, equivalence testing provides a rigorous method to determine whether this represents true similarity or merely insufficient evidence of difference. A proposal for interpreting and reporting negative studies, 2025. Conceptual and methodological equivalence in cross-cultural research. Frameworks for equivalence assessment. In cross-cultural research, the concept of equivalence becomes considerably more complex. Vijver and he 2020 establish a framework distinguishing between bias and equivalence, where bias represents systematic errors that threaten comparability, and equivalence represents the absence of such systematic errors. This framework recognizes that equivalence is not a binary state but exists at multiple levels, from construct equivalence through metric equivalence to scalar equivalence. Each level represents increasingly stringent requirements for meaningful cross-cultural comparison. The most fundamental level is construct equivalence, which addresses whether the same theoretical construct is being measured across different cultural contexts. A construct that exists and operates similarly in one culture may be absent or functionally different in another. Vijver and he, 2020. For instance, the concept of self-esteem may hold different meanings and relationships with other variables in collectivist versus individualist cultures. Establishing construct equivalence requires thorough literature review, expert consultation, and pilot studies in each target population. Vijver and he, 2020. The measurement equivalence typology. More detailed typologies have been developed to address the specific challenges of cross-cultural measurement. Stevelink and Brakel 2013 propose a comprehensive framework distinguishing among conceptual, item, semantic, operational, and measurement equivalence. Conceptual equivalence examines whether the domains representing a construct maintain the same relationships and importance across contexts. If the construct of illness identity, for example, comprises domains of engulfment, rejection, acceptance, and enrichment, conceptual equivalence requires that these domains have the same structure and relative importance in both the original and target populations. Stevelink and Brakel, 2013. Item equivalence represents another crucial dimension, addressing whether individual items that measure a latent trait mean the same thing in different contexts. Stevelink and Brakel, 2013. This goes beyond simple translation quality to encompass whether the content of an item is relevant and acceptable across populations. An item about participation in church activities may be a valid indicator of social engagement in a predominantly religious society but less so in a secular one. Semantic equivalence specifically addresses translation quality, ensuring that translated items have the same meaning and produce the same effect on respondents across languages. Stevelink and Brakel, 2013. Operational equivalence concerns whether the mode of administration, format, and instructions can be applied consistently across contexts. Factors such as literacy levels, familiarity with particular response formats, and cultural norms around self-disclosure can all affect whether an instrument functions equivalently across populations. Stevelink and Brakel, 2013. Finally, measurement equivalence assesses whether the psychometric properties of an instrument including reliability, validity, and responsiveness are comparable across contexts using statistical methods such as factor analysis, Cronbach's alpha, and intra-class correlation coefficients. Stevelink and Brakel, 2013. The three-step approach to assessing measurement equivalence. Step 1. Construct equivalence. In international business research, a systematic three-step approach has been developed to assess equivalence, providing a structured framework for researchers' equivalence in international business research, 2022. The first step addresses construct equivalence, requiring researchers to determine whether the construct has the same meaning across the populations being studied. This involves considering whether to adopt an emic approach examining constructs from within the culture or an etic approach using universal constructs that can be applied across cultures. Construct equivalence exists when the construct shows comparable properties across countries, with similar patterns of convergent and divergent validity. Equivalence in International Business Research, 2022. When construct equivalence cannot be established, researchers may need to investigate the emic dimensions of the construct, understanding how it is uniquely expressed in different cultural settings, or develop new instruments that capture the construct appropriately in each context. Equivalence in International Business Research, 2022. The possibility of partial equivalence, where some dimensions of a construct are comparable but others are not, must also be considered. Equivalence in International Business Research, 2022. Step 2, Method Equivalence. The second step examines method equivalence, ensuring that sampling procedures, data collection conditions, and measurement procedures are sufficiently similar across populations to permit meaningful comparison. Equivalence in International Business Research, 2022. This requires addressing questions such as whether samples are equally representative in each context, whether data were collected under comparable conditions, and whether variables were constructed following the same procedures. In survey research, method equivalence also encompasses issues of response style, item wording, reverse items, and common method bias. Equivalence in International Business Research, 2022. Method equivalence can be particularly challenging in cross-national research where different cultural norms around survey participation, social desirability biases, and familiarity with particular research methods can substantially affect responses in ways that are unrelated to the constructs being measured. Equivalence in International Business Research, 2022. Researchers must demonstrate that observed differences are not driven by methodological artifacts, such as one country having a much larger sample size or different demographic composition. Step 3, Item Equivalence. The third step addresses item equivalence, determining whether the specific items used to measure a construct have the same meaning across samples. Equivalence in International Business Research, 2022. This requires not only careful translation but also statistical assessment of whether items function similarly across populations. Techniques such as confirmatory factor analysis (CFA), equality of variance tests, exponential random graph models, and cluster analysis can be employed to demonstrate item equivalence. Equivalence in International Business Research, 2022. When item equivalence cannot be achieved, researchers may need to look for alternative constructs, develop new instruments, or investigate sources of item bias. Evans et al. 1997. Rash item analysis can be particularly valuable for identifying items that function differently across groups, allowing researchers to refine instruments by removing or replacing problematic items while maintaining the core content validity of the measure. Evans et al. 1997. Practical challenges and solutions in establishing equivalence. Statistical detection of non-equivalence. One of the significant practical challenges in equivalence research is detecting when equivalence has not been achieved. Evans et al. 1997 propose a pragmatic approach based on the psychometric axiom that a measure with low reliability cannot have validity. If internal reliability statistics differ substantially across groups, this may indicate non-equivalence. This simple approach exposes most problems in the detection of equivalence, using data that researchers already collect rather than requiring additional resources. Evans et al. 1997. Importantly, non-equivalence may reveal meaningful cross-cultural differences rather than merely representing a methodological problem to be eliminated through more translation work. Vijver and he, 2020. For example, Different dimensionality of eating and body image concerns across cultures may reflect genuine cultural differences in how these constructs are experienced and expressed, rather than measurement artifacts. Researchers must be cautious about interpreting non-equivalence as simply a measurement problem requiring technical solutions, when it may represent substantive cultural differences worthy of investigation in their own right. Vijver and he, 2020. Strategies when equivalence cannot be achieved. When equivalence cannot be fully achieved, researchers have several options beyond abandoning the comparative project. One approach is to conduct separate analyses for each group, investigating the construct in its culturally embedded form rather than forcing comparisons that may not be valid. Vijver and he, 2020. Another is to perform subgroup analysis to identify specific populations or contexts where equivalence holds. Stevelink and Van Brakel, 2013. Researchers may also need to refine constructs based on what is learned about how they operate differently in various settings, developing theories that account for cultural variation rather than assuming universal applicability. Vijver and he, 2020. The concept of partial equivalence recognizes that it may be unrealistic to expect complete equivalence across all dimensions and populations. Equivalence in International Business Research, 2022. Some aspects of a construct may be comparable while others are not, and researchers must be explicit about the degree and nature of equivalence they have established. This nuanced approach to equivalence may be more realistic and scientifically honest than requiring complete equivalence as a precondition for any comparative research. Stevelink and Van Brakel, 2013. Conclusion: the concept of research equivalence represents a critical methodological principle that profoundly shapes the validity and interpretability of research across multiple domains. From the statistical testing of treatment effects to the cross-cultural validation of measurement instruments, equivalence requires rigorous methodological attention that goes far beyond merely failing to find significant differences. Ponce-Renova, 2022, A Proposal for Interpreting and Reporting Negative Studies, 2025. The statistical framework of equivalence testing provides a principled approach to demonstrating that two treatments or measures produce effects that are practically indistinguishable. By specifying equivalence bounds based on substantive knowledge and using confidence intervals to test whether differences fall within these bounds, researchers can avoid the logical fallacy of concluding equivalence from non-significant results. Brigham and Women's Hospital and Harvard Multi-Regional Clinical Trials Center, 2022. This is particularly important in clinical research, where claims of treatment equivalence have direct implications for patient care, and in replication studies, where determining whether effects are truly similar across studies is essential for scientific progress. Ponce-Renova, 2022. In cross-cultural research, the multiple levels of equivalence from construct through measurement equivalence require systematic attention to ensure that comparisons are valid and meaningful. Vijver and he, 2020, Stevelink and Van Brakel, 2013. The three-step approach provides a practical framework for assessing equivalence at construct, method, and item levels. Equivalence in International Business Research, 2022, while the typology of conceptual, item, semantic, operational, and measurement equivalence highlights the diverse ways in which incomparability can arise. Stevelink and Van Brakel, 2013. When equivalence cannot be fully achieved, researchers must be thoughtful about partial equivalence, cultural specificity, and the substantive meaning of non-equivalence rather than treating it merely as a methodological problem to be overcome. Vijver and he, 2020, Evans et al. 1997. Ultimately, the pursuit of research equivalence reflects a deeper commitment to scientific rigor and intellectual honesty. It demands that researchers be explicit about what they mean by same, clear about the criteria by which equivalence will be judged, and honest about the limitations of their claims. In an era of increasing attention to replication, reproducibility, and cross-cultural validity, the careful assessment of equivalence is not merely a technical requirement but a fundamental aspect of trustworthy research.